Hello, good evening, everyone. Welcome to our another session of very interesting Young Turks meeting. Today, I have a very good speaker amongst us, Dr. Shakti Tripathi. And so many times we do this preparation for, FET and all, and we are worried that the endometrium is not looking as good as it was while I was giving the estrogen. We have so many questions received by our young clinicians. They say that, ma'am, the endometrium looks compacted. So, what could be the possible reason and what is the outcome? So, Dr. Shakti is going to talk about that today. I do. It's my pleasure to invite our first expert, Dr. Sunita Chandra. She is the director of uh, just a second, Rajendra Nagar Hospital and IVF Center in Lucknow. She is on the advisory board member of IFS UP chapter. She is the member Quality Council of India, ex-member ISOPAB Lucknow, and president APGI Lucknow. She was the joint secretary and past secretary of APGL, founder joint secretary of IFS, and secretary IFS UP chapter from 20 to 22. She has many awards and achievements to her credit, and the best is the IFS Achiever Award in 2023. She was awarded for a e-poster, many publications on her special interest is in PCOS, IVF, ICSI, and lap surgery. She is honored with Nari Shri Samman in 2024 and honored for exemplary contribution to society by Fever FM on Women's Day. She is active
Welcome,
on
Dr.
social,
Sunita.
academic, and cultural platforms. Ma'am, please, it is our pleasure to invite you, and I would
Thank
request you to
you.
please introduce our speaker.
Yeah, welcome, Dr. Sunita. She's very active on all social, academic, and cultural program. So next we have one more chairperson, Dr. Divya. Yeah, she's also today's expert. She is director of Ayushman Multi-Specialist Hospital and Mafias Okriti International IVF Center, Varanasi. Specialist in gynae endoscopy, infertility, and high-risk pregnancy. Organizing secretary of Foxy Northstone Conference with UA 2023. She is at present joint secretary of our IFS UP chapter, joint secretary of ICOG 2012. Organized various IUI histoscopy conferences, contributed chapters in the book, presented paper, awards, recipient of Foxy Achiever Award. So welcome, Dr. Divya. Next. Yeah, Dr. Shakti. Dr. Shakti is our presenter.
Ma'am, I would request Dr. Sunita ma'am to invite our speaker today.
Hi everyone. Thank you, Niru, and thank you, IFS, for giving me this opportunity to be here as an expert for this a very, very important session.
It's our pleasure, definitely.
As Dr. Nisha already said, that when we are preparing our patients for FET cycles, it's always a nightmare when you see a very good triple layered endometrium around 8, 8.5, and on the day of transfer, it shrinks. So, I mean, you are in a dilemma whether to transfer, whether not transfer, and you cancel so many cycles. So this is like a sunshine, this is going to be a game changer for all of us that yes, compacting endometrium is not bad. In fact, it increases pregnancy rate. So to hear this, we have Dr. Shakti Kumar Tripathi. He is Chief Reproductive Medicine Specialist, Dr. Shakti and Dr. Ipsita Skin Fertility Institute, Bargarh, Odisha. Center of Excellence for Reproductive Medicine, IVF and Cosmetology. He is MS, Fellow in Reproductive Medicine from Kraft, Kerala, and Fellow in Minimal Invasive Surgery from EVA, Ahmedabad, Nanavati, Mumbai. Fellow in Male Infertility and Sexual Health, Fellow in International College of Robotic Surgeons, WOW. Trained in Embryo Transfer Course at Amsterdam, Europe. Diploma in Reproductive Medicine, Germany. And he has many awards to his credit. National Award is Foxy for Best Paper, Academic Achievement Award IFS Locks Lucknow. Wow. So Locks is mine, Lucknow. National Youth Icon Award Yuva SR Kochi, IFS Achiever Award Ahmedabad 2024. And more than 50 faculty presentations at state and national levels. Ambassador for Mission for Cancer Prevention. Very good. You're doing a very good work. Founder, Shakti Foundation a non-profitable social organization. He's co-editor for AOGO Focus Foxy and convener Men Matters Conclave. So, Dr. Shakti, now dais is yours. We all really want to hear from you about this compacting endometrium. Please go ahead.
Yeah, thank you, ma'am, for this introduction. And the title of this presentation today, endometrial compaction before frozen epiloid embryo transfer that improves ongoing pregnancy rates. This journal published in Fertility and Sterility, and the authors Ilan Jelinbach, MD et al. And most important thing, before presenting this journal, we'll follow as per the protocols, and starting with the introduction of this publications, that for I think everyone knows, for any abnormal for a normal healthy pregnancy, two things are most important. That is, the first one is the euploid embryo, second one is the endometrium. And for the embryonic euploidy, it's known to be the major cause of early miscarriage and one of the most common cause of recurrent pregnancy loss or RPL cases. So by performing a pre-implantation genetic testing for aneuploid PGTA, it might be possible to increase the chances of live birth rate. Then the second one is, this is assumption that it means the contribution of these factors. We can go for a PGTA for this study also. They have done in this study population. And second one, the second most important factor, that is the receptive endometrium, and thought to occur during the window implantation. And what is the window implantation? I think for a 28-day cycle, the day 20 to day 24 is the most important period for that we can call as a window of implantation. So early studies suggested that transvaginal ultrasound might serve as an alternative method. Before that, we are going for more invasive method like biopsy for the prediction of the favorable endometrium. So a significant increase in the ongoing pregnancy in the endometrium and decrease in thickness between the end of the estrogen phase, that the term which was coined as compaction in study, I think this is the second study. The previous study, they have done in non-PGT cases. In this, in all cases, they have transferred with a euploid embryo by doing a PGD and by a HRT cycle. So they coined the term compaction, that is decrease in the thickness of endometrium after completion of the, that is on the day of embryo transfer, after completion of the 6th day of progesterone. So in this multivariate analysis, that study shows that the embryo morphology quality and the endometrial compactions both significantly affect the pregnancy outcome. So the main objective of this study to assess whether the calculated difference in endometrial thickness from the end of the estrogen phase and on the day of endometrial the embryo transfer, that is everyone doing this blastocyst transfer after 6 days of progesterone in the hormonally prepared cycle associated with increase in the ongoing pregnancy rate, in particularly in euploid embryos. Then if we see according to this study, the materials and methods, the study design was a observational cohort study, and this is a single center study with a study population of 234 FET cycle after PGTA. And the time period was from February 2016 to October 2018. And the study design and the study of efficacy, this is approved by the Veritas Institutional Review Board, and all patients in the study has a FET with a single blastocyst transfer. And after the oocyte were retrieved as per protocol, I think the ICSI was performed with all M2 and with a denuded oocyte approximately 3 hours after post retrieval. And the all derived embryo is cultured with the live global media and supplement with LPGS and from the Cooper surgicals and the humidified environment for 5 to 6 days post ICSI. And on the day 3 in this study, according to this study, they have gone for the hatching of this day 3 embryo using a laser to facilitate the herniation of the prophyectoderm on the day 5 and day 6. So prophyectoderm biopsy were performed on the day 5 and day 6 to culture depending upon the embryo development. And the biopsy was done with a microscope mounted laser with a vitro light to facilitate the detachment of the cell. And after the biopsy, the prophyectoderm sample were tubed and sent to the genetic lab for the analysis. And the tested embryo again vitrified with 1 to 2 hours after biopsy. So all the cycles involved here is the exogenous hormone replacement therapy, that is the HRT cycle as we call. And patient started the hormonal therapy with the exogenous of estrogen from day 2 or day 3 of the natural cycle, and were downregulated with the GnRH agonist started in the prior luteal phase, and the exogenous E2 was started from day 2 or day 3 of the following cycle. So the estrogen was administered orally or vaginally, depending upon the physician and the patient's preference, about 10 to 12 days. And the patient was called, and the transvaginal ultrasound measurement of the endometrial thickness was performed, and measuring the endometrial thickness and the pattern. The endometrium was considered adequate to start progesterone administration if it was more than 7 mm, that is important, with a triannular pattern. If not adequate, further dose of estrogen was administered and the serial ultrasound was performed. So when the endometrial thickness was optimized, the patient's commenced with the progesterone treatment was started, and this can be in oil-based injections, IM, or the vaginal progesterone. And these brands like Endometrine from the Ferring Canada, and this was started. And after 6 stages of progesterone, the patient was again called, and the ET was estimated from the transabdominal. Here you have to, most important thing, here the ET was measured transabdominally, and with the then followed by embryo transfer. So measurement of endometrial thickness on the day of ET, ultrasound images are retrieved using a imaging software, and the best image showing the longitudinal section of the endometrium, including the cervical length, was measured using the electronic calculator built into the software. So they had also calculated the delta between the endometrial thickness and the ET and the endometrial thickness at the end of the estrogen phase. So the primary outcome was the ongoing pregnancy rate, and which is defined as the fetal heart rate done after 12 weeks of gestational or later. The statistical analysis, if we see, then you can see that the comparison of the continuous variable between the two groups were conducted using the student's t-test. The chi-square was used to the comparison category, and the logistic regression was used to multivariate analysis, and the p-value less than 0.5 was considered statistically significant. And the statistical analysis were conducted using the IBM statistical package for the social science. The sample size, as we have mentioned, is 234. And 9 cases was excluded from the study because of the poor ultrasound image quality, preventing them for the accurate measurement of the endometrial lining at the time of embryo transfer. So if we see the ongoing pregnancy and the percentage of compaction, this is the most important slide of this study. I can show that with the compaction of 15%, the ongoing pregnancy was around 51.5%. That's the highest. They have categories into different, like 5%, 10%, 15%, 12%. Out of these, if the compaction is 5, with a 50% compaction, ongoing pregnancy was maximum. Then if we see the variability, they consider every part like age, body mass, the lining, and all factors were considered, and they have compared between the compaction and non-compaction groups. So if you see the rate of achievement of compaction, that it decreased to 15% or more, the endometrial lining before it was 29. And these data set are all groups like 5%, 10%, 15, 12%, all resulted in the increase in the significance ongoing pregnancy rates. So the conclusion, the compaction of the endometrial lining in the FET cycle with a single euploid ET, the result in a significant increase the ongoing pregnancy rate compared with the cycle which its line did not compact. And measuring the endometrial thickness at the end of the estrogen phase before the starting the progesterone treatment and before embryo thawing to calculate the compaction rate may be easy, efficient, and low-cost method to improve the ongoing pregnancy rate in hormonally prepared cycle. Next is the most important thing, that is for this the Strobe statement for this for this study. That is Strobe statement. Everyone knows that is turning the reporting of the observational study in an epidemiology. So we can just see in which way this study is the meeting all the criteria according to a checklist, so that we can clearly mention one by one. Starting with the title of the extract, if we see that the endometrial compaction before frozen haploid embryo and transfer into the ongoing pregnancy, here you can see with the study title, the study design was not mentioned, like it is observational study or cohort observation. As for that, they have not mentioned in the title, and I think that should be mentioned. And second thing, the the number of cases they have got like 234 cases, that should be also mentioned in the in the title of the study. So that part is lacking. And it's providing and second thing for the information balance summary of the what they have done, that is also I think it is here mentioned in the study title and the abstract. Second, if you see the background and rationale, that is clearly mentioned why like what the scientific background rationale for this, and they also coined the term compaction, the new terminology that is also mentioned. Then if you see the objective of this study, then the difference in the endometrial thickness from the end of the estrogen phase and the day of ET, that everything is clearly mentioned in this study. MBC for the study design, that is observational cohort study, that is also key, one of the key elements of the study design, that is also clearly mentioned. And if you see for the study setting, then single center study, it is an observational cohort study or 234 FT cycle with a PGTA, that is most important. The cycle occurrence between this duration was also clearly mentioned in this study. If you see the participant, how they have method of selection of participant, here only the criteria like starting from in all cases they have done PGTA for the they planned for this single embryo transfer. Yeah. And lastly, the variability, if we see, that is lot of variability. That is, in this study, there are 3 investigators that are performing the ultrasound. That may be a confounding factor. So that is the assessment of endometrial thickness. There may be some variability. That is one of the important point in this study. And the data and measurement, if you see how they have collected the data, what is the selection criteria, how they selected this number of sample size, this what is not mentioned. And there is some observational bias may be there in this study because the 3 investigators, they perform the all ultrasound, that may be some observational bias. Then if you see the study size, here is clearly we can see that how they selected this number of population, the study sample. That is a sample size estimation. We know that should be properly estimated how when you are taking some samples. That is not given, and no flowchart was also given in that study. There is not a single flowchart. Now, secondly, if you see for the quantitative variability, that part also I think it is not applicable on this study. And if you see the statistical method, then we can see that the student test, Chatsworth test were used to comparison of the categorical variable. This is mentioned in this study. And the method, that is endometrial compaction, this part they have mentioned, explain how the missing data is addressed, that is mentioned before. They have 8 cases was not included in the study because of they are not able to measure the endometrial thickness in the properly. And I think how they manage, that is this loss of follow-up cases, that 8 cases, how they managed in the statistical analysis, that part also not mentioned. And any sensitivity analysis also not mentioned. And if you see for the participants, then the data from the 9 cases were excluded from the study because of the poor ultrasound imaging quality, prevent for accurate measuring the endometrial thickness. This was mentioned. And like flow diagram we already discussed. Then for a descriptive data, then this is mentioned, this is a observational cohort study, and they mentioned 34 cases with 9 missing data, and the follow-up period was up to the ongoing pregnancy till 12 hours. This was mentioned. And if you see the outcome, then in this study the report numbers outcome behind, if you particularly you can see here that in terms of pregnancy they have gone up to the ongoing pregnancy rate more than 12 weeks. And if you see for the main results, then how the confounding is adjusted, and that part is not clearly mentioned. And if you see for the report category, I think continuous value, this part is not applicable in this study because of observational in nature. And if you see for the other analysis, I think you have mentioned about the 4 subgroups, like from 5%, 10%, 15%, 20%. The compaction, this was mentioned in the study analysis, and accordingly they have done the statistical analysis. And if you see the key result, that was the summarized and objective, everything is here mentioned, everything given. And if you see for the limitations of this study, you can see part 1 is during the 6th day of progesterone, where they are planning for the embryo transfer. In that day, the ultrasound was done transabdominally. I think this is one. This is one of the limitation factor here, and this is the other limitation factor. This is a retrospective study, and the sample size is small. And this is the three important limitation in this study. And if you go for the interpretation, like the objective and the multiplicity of analysis, some previous study, I think one of the previous study which was published same journal in fertility sterility only, where the PGD was not done. It has, but in this study, all cases they have done the PGD. So this has been mentioned here. And if you see for the generality of this study, I think as per the sample size and is a small and observational study, the generality cannot be done in all cases. And about the funding, in many, I think in lots of companies' names, including everything is mentioned here, starting from the different culture, media, ultrasound, everything hatching, but no information about the funding here in this study, it is not mentioned. So thank you all for this kind listening. Now it is hand over for discussion.
Yeah, thank you, Dr. Shakti. It was a nice presentation, excellent. Dr. Sunita, you want to give any comment? Please unmute. Please unmute. You are muted. Yeah. Still, huh? Dr. Sunita is muted.
Yeah, it's okay, na? Yeah, ठीक है, done.
Fine.
Actually, after this article, when you gave me this, ki Dr. Sunita, please read it out. So, first of all, I would love to thank Dr. Shakti. He has really done wonderful job, and I mean, he presented this paper very nicely with the shortcomings of the paper also. And he cleared out each and everything regarding this article. What is it all about and what should be there and what was there. I actually read 2-3 papers. Latest also 24 papers. ISAR also published one article regarding this compaction of endometrium. Does not decrease chances of pregnancy. In fact, it increases chances of pregnancy. So what I came to know in all the articles, I concluded that they say that clinical pregnancy rate, ongoing pregnancy rate may be more in this kind of patients, but there is no difference between live birth rate. So if we talk about compaction, where we were really worried and we used to cancel the cycles, we can go ahead. But in our setup, that Dr. Niru will also agree and Dr. Divya will also agree with me, that we are not doing PGTA in all the patients. I mean, we don't select all aneuploid embryos and transfer, because this is a quite costly thing and we always have this constraint of cost. So if this study only has taken into account these aneuploid embryos. Although other studies which I went through, they just talked about compaction of endometrium, that it does not decrease your chances of pregnancy, chances of clinical pregnancy, ongoing pregnancy, but there is no difference in live birth rate. So, and एक और भी चीज उसमें था कि they have not actually defined how much decrease in the size. Like when it was 8, so 6 was okay, or even 5 was okay, 5.6 was okay. So what is the boundary line of this compaction, that in proliferative phase it was 8 and now it is 6 or less than 6, can we transfer the embryo? So these things were also not very clear in these studies. Dr. Dibbe, I think you can go ahead with your...
Yeah, thank you, Dr. Sunita. Yeah, it's very clear. That's Dr. Shakti. First of all, congratulations. You have presented this study in a very good way and you have summarized everything beautifully. And as said by Dr. Sunita ma'am, this study, first of all, there are certain, I think, the drawbacks. First of all, I can see that all the ultrasound has been done transabdominally. I think it's very difficult to exactly measure the endometrial thickness, and there are confounding factors also, because the all the participants and the workers and who are doing the ultrasound, they are different. And I just wanted to know, is there any role of Doppler? Have they put the Doppler also to know about the what is the Doppler flow? Because this also becomes an important factor in knowing the centimeter thickness and what is the this relation with the thickness, this pregnancy rate. So they have not mentioned anything about the Doppler. This was not mentioned, Dr. Shakti?
Yes, yes, ma'am. Doppler was not done. Only they have
Mm.
done 2D. This part, that much only.
Yeah,
Doppler is
yeah,
not done.
Definitely, Doppler and Applebaum criteria is
Yeah,
very
yeah, not done.
important. Yeah.
yeah.
Yes, ma'am.
Yes. Okay. So they have just only measured the compaction and
Yes.
there was no definite, like whether it was more than 7 mm. So it was 8 mm or 9 mm. Was there any difference in the pregnancy rate in between these two diameters also? They was not mentioned. They were more than
Yeah.
7 mm. They have taken the criteria.
Yes, ma'am.
Dr. Sunita, you told about PGT funding. Yeah, you are absolutely right. Very costly affair also. Secondly, after ART bill also, we can do PGTA in certain cases only.
Yes, very
Especially if
right,
the
very
age is
right.
more than
Huh.
35 or severe odds or severe or recurrent implantation failure or recurrent abortions, then only we can do. Otherwise, we cannot do also PGT in India nowadays.
Bilkul.
Yeah.
Dr. Shakti, you would like to say some comments?
Yes, ma'am. First thing is, as we discussed, like we are doing more giving emphasis on the endometrial receptivity part, particularly in RPL cases, in RIF cases also. And we are sometimes advising some cases which is like ERA, one of the example. So where that is, I think, little robust evidence for the support of this ERA test we can recommend. So for this, and that is also expensive also. And
Yeah.
these cases of patient, I think this is one of the options by seeing the endometrial compaction, which is, I think, no cost. We are routinely doing ultrasound for this group of us patient. That is something, give some add-on to your, when you are deciding to, you are planning for a transport or not in this next cycle. And second thing, I think they are, this study group, they have published first study in 2019, where they have done this FET endometrial compaction with all cases, like they have not done PGD. And for the rule out this embryo causes that if any confounding factor, for all cases they have done this PGD and published again in Fertility Sterility in 2020. And they have found the same result. But there is lots of study in the last few years, starting from one Chinese study also there. They have done with a huge, like more than 5,000 cycles. They have concluded that that is not significant. Endometrial compaction is not significant. So there are lots of articles with lots of this other opinions also. And they have further mentioned that in this article that they are planning to initiate another study, a prospective study, to examine whether the endometrial compaction with progesterone can be determined before embryo thaw to prevent the FET cycle in a low chance of success. So how we can endometrial compaction can predict the success of a IVF cycle. They are planning to go for their ongoing studies going on from the same group only.
Yeah, definitely. So thank you, Shakti, for the wonderful, excellent presentation. Anything else you want to add, Dr. Sunita or Dr. Divya? Hello.
Yeah, Dr. Neetu, I think everything has been mentioned and discussed, and still a lot of more studies are to be needed to find out whether what is the role of what is the role of the compaction and how is it related to the pregnancy rate.
Yeah, definitely. So thank you, Dr. Sunita, Dr. Chandra, and Dr. Divya for joining and your excellent comment. Shakti, you have done very good
Thank
job
you.
as a nice article. And I
Yeah.
suggest all the participants and all the YP members to select few articles, journal, and be actively
Yeah.
participate in this journal club we are doing every second and fourth Friday at 8 p.m. It's really knowledgeable. We can share and gain our knowledge. Definitely. And
I think, ma'am, for
congratulations.
this, we need a multicentric, this randomized study so that we can get a clear
Yeah.
message. We can, for the applicability or generality of this endometrial
Yeah, it's a
compaction.
low cost, no cost also added. So
Yes,
we
ma'am.
can do a multicentric, definitely.
Yeah.
You can take the lead, Shakti. You all
Thank you,
can be the
ma'am.
part of this.
Yes, ma'am. Thank you.
Definitely. And congratulations everyone for the successful fertivision in the Gujarat, Ahmedabad. Now be prepared for the next fertivision in the Delhi next December.
Yeah. Yes, madam.
So thank you everyone. We are doing this channel club, different presentation, mentoring session also, and now we are going to soon start the debate session also. So we can have a different topic. So I suggest and request all young Turk to be actively involved and be the participant and tell us anything else you want to present, you want to share, you want to gain. So that will definitely increase knowledge for everyone and
Yeah.
share the knowledge. So thank
There's
you.
some chat box. There's some queries in the chat box, I think, ma'am.
Okay, I'll have definitely. Yukti Bhardwaj. What is significant compaction and when to measure? Please repeat. Shakti?
Yeah, yes, ma'am. So significant compaction, in the simple word, I can say compaction means the decrease in the endometrial thickness. That is from the day when you are starting the progesterone to the day of from the day you are starting to from the day of transfer. That 6 day. So when you are starting, you have to see the what is the endometrial thickness, and after 6 day, when you are going for a blastocyst transfer, on the same day again you will see, and what is the decrease in the endometrial thickness. It is 5%, 10%, or 15%, 20%. And accordingly, they have just decreasing this length endometrium. They have mentioned coined this term as compaction, and the measurement that will be done on the day of embryo transfer. That is most important.
Yeah. And they have seen 15% compaction
Yeah,
was the maximum
with a good result. Yeah, good
good result.
ongoing
Even
pregnancy.
50%. Yeah.
52%.
Yeah.
Yes, ma'am. Yeah. That's
Any
what.
other queries if anyone have? No, I think. So you have done everything very clear.
Yeah, ma'am. Thank you, ma'am.
Yeah, embryologist can also be the part.
Yeah.
So we can have everyone topic, embryology, clinical, endoscopy, everything related to fertility. Everyone can be part of the journal club. So thank you everyone. Thank you Dr. Sunita, Dr. Divya, Shakti and everyone. And with this, we wind up the session and take leave.
Thank you. Thank you, madam.
Thank you. Thank you.